Yeah, my name is Claudia, and I am a physician. I'm actually a physician scientist involved in clinical scientific medicine for 35 years. And I spent time in a laboratory that is a molecular biology laboratory. Then I started to get sick, and I got sicker and sicker. Because of my background, I just plain wasn't going to just get sicker and sicker and sicker without figuring out why I was getting sick. And nobody could figure it out. I had a series of symptoms. I was able to research them. But putting together the diagnosis or getting people actually to believe me, which interestingly was very hard, became rougher and rougher. Look at things. I saw how Dr. Harris dealt with my son. I knew the challenges my son had. I knew the safety issues that came with ketamine, and I felt they were being taken care, and then the psychological issues. I felt they were being taken care of in a way that I felt confident with. Watching as an anesthesiologist with my son with this therapy, he went through the ingredients that came from this infusion that was designed by this European physician. And together, because I'm a kidney doctor and he's an anesthesiologist, we sort of tried to dissect what each component meant. Now for me, I wanted to get better, but I also because I'd been sick, I hadn't had the opportunity to talk medicine and so I had fun just finally talking with someone who could use my language, and I think both of us enjoyed this. We could challenge each other, and we went deeper and deeper and deeper. And we had a few occasions where he came up with something that I should have known as a kidney doctor. And, he knows what those are, and we both still probably laugh about them. As the treatment started, and after, 3 or 4 weeks, my body started evolving. And based on the change in my body, our clinical findings that would only be picked up by a good clinician, changes of the skin, we realized that together, but definitely led by Dr. Harris, that I still had ongoing infection. And so Dr. Harris added to the infusions. It's a high level, but it's a common antibiotic. The relationship between Dr. Harris and his patients, I was able to observe firsthand as I was in the waiting room and seeing both my son and other patients come in. And these are very difficult or challenging situations, and it needs to be dealt with a knowledge base, but also with empathy and establishing a connection. And I've seen a lot of doctors. I've taught a lot of doctors, and Dr. Harris has an ability to connect with his patients or clients in a way that we try to teach to our medical students and can't always get. And then he mixes this with quite a deep knowledge base that allows him to figure out what an individual patient has. And it's not just cookie cutter, it's really individualized. most important things to somebody like me who's made thinking a core of my being, that was taken away from me, and it's coming back. I am a believer in micronutrient infusions. The field of nephrology is actually a field of metabolism, so I know these things are at least the pharmacology of things in a very deep way. And so I understand why a given constituent is in something, but it has to be individualized. It has to be. And the fact that he has the knowledge base to do that, I think, is important. And one can probably make get some benefit from standardized, but you're sure going to get a whole lot more with customized.
When I first met Claudia, it was actually as an aside. She accompanied one of her family members who was seeking treatment with us for depression. And I could tell that she was suffering, but I really didn't know the backstory. When she approached me one day, I was absolutely fascinated with the complexity of her history, both clinically and emotionally, as she had struggled to recover from a very rare and very debilitating situation. Thankfully, she had ventured actually outside of the United States to seek care when she first became aware that possibly dentistry and the lymphatic drainage of the root canal that may have become sort of chronically anaerobically infected, that may have been the cause. And so she went actually to Switzerland and then Costa Rica to seek relief. And when she presented me with this infusion protocol that included a lot of ingredients, some of which make sense, some of which I've used myself, but not necessarily all together. And so after a lot of research and exploration in terms of sourcing, we were actually able to come up with this unique protocol and source it from areas all over the world, including Ukraine and Colombia. And I really enjoyed the intellectual discussions that me and Claudia had engaged in during her treatments and between them, as we sought to both better understand what her body was going through, to the point that we actually came to believe that while the resorption of, possibly impure dental materials may have started this cycle of negative health consequences, it was actually the infection that probably had traveled through her lymphatic system and had deposited itself peripherally all throughout her body, much like an infective endocarditis would present. And in fact, that had actually been a diagnosis that she explored, but it never was found. So by adding an antibiotic regimen to the protocol that she had brought to me, we began to see really amazing results in terms of her decreasing what she would describe as the feeling of toxicity. Swelling seemed to resorb from her extremities, and she was actually releasing a lot of these foreign bodies and sort of infectious foci through her skin. It was the craziest thing to watch. In addition, the skin itself softened, and the fibrotic connectivity seemed to decrease such that we were actually able to better insert IVs based on the lack of tortuousness of the veins. They actually straightened out when they weren't adhered to the connective tissue around it. It was really a remarkable transformation that she's still undergoing, but it's been an honor to be a part of her journey. Desiree. I could tell there was this really sensitive, beautiful young woman who was really struggling under the weight of crushing anxiety, and it wasn't until we really addressed the anxiety that we realized that there was actually a great deal of depression underneath that.
My name is Desiree, and what brought me here is that I just had like this cloud, like a dark cloud over my head. I couldn't concentrate on the little things anymore. Dr. Harris is really calm, and he was confident. So that made me confident that I'm gonna be taken care of. He's easy to talk to, listens, and takes his time. And there's times where I felt bad, like I was like, oh my gosh, like you have a family to go home to, and doctor's like, don't worry, everything's okay, you're gonna be okay. And it really helped me to feel comfortable in my situations and that I was gonna be okay. And also the mindfulness work, the inner work really helped to feel that I'm not gonna be dependent on medications anymore, and I'm not. That's the only thing that can really explain it. Extraordinary. I was talking to my roommate the other day about going to treatment also for her personal issues. And she said, I want to do it because I saw you do a 360 turnaround in 3 weeks. It happened so fast. Like I didn't even realize it was happening that fast. And other people can see the change in me too, and that felt nice. And even looking back, I noticed a lot more. Like every time I concentrate more on looking back at from the beginning to where I'm at now, I can see a huge change in the things that I didn't even notice. That my depression was way deep rooted. It had nothing to do with just a quarantine or, like a bad breakup, that it actually had to do with me, myself. And it can help me find those patterns. The change definitely I felt the shift when I started to be able to do things again. I started to do my schoolwork again. I enrolled in my real estate. I talked about it for 4 years, never got around to it. I finally did it, and I actually graduated the school in November.
Several months later, after she completed her stabilization course of 6 infusions many months ago, is happier than she's ever been, and it's just a real pleasure to see her again and to see her beautiful success.
I think that the thing that would be the most helpful is like even my friends, to make the phone call to get help. Even reaching out for help is the first sign that you need help. I do recommend ketamine therapy, doing mindfulness work, even getting therapy in general is definitely a lot of help. I would not recommend taking a pill form medication ever again to anybody. I just don't believe in it anymore. I recommend patients to come here because it's definitely a guaranteed thing. You're gonna get the help that you need. If you want something that's gonna be more long-term, definitely go to NeuroRelief office.
My name's Greg, and the reason I looked into ketamine, I've been dealing with anxiety, depression, addiction issues as well. I've tried many modalities as I come from the background of holistic. I've done everything under the sun, from changes in diets to meditation, exercise. The reason why I came to NeuroRelief and decided to pull the trigger here is because there was a friend who went through the treatment with Dr. Harris initially, and she had nothing but great things to say, not only about ketamine itself, but as to what Dr. Harris provided her.
When I first met Greg, he was suffering from a great deal of anxiety, but I could tell he was really a kind gentleman who was on a spiritual journey to find the best path forward for him. I'm pleased to say that after completing his stabilization protocol and during his follow-up conversations with me, he has seen significant improvement in his overall anxiety, in his outlook on life, in his feeling of connectivity with the world around him, and that seems to be inspiring him with a great deal of confidence and positivity.
Dr. Harris was very accommodating through the whole entire process. He really cares about the patient and is very accommodating to their well-being and making them feel as comfortable as possible. After the first session, there was already drastic improvement, but it was a succession of treatments that really brought out the entirety of the magic, so to speak. So far, depression's down, anxiety down, non-existent, better relationships with the people that I was having difficulties with, just a better understanding of myself as a person. It's something that I've really felt that has stood out. I feel that the best advice I can give anybody is to just not be afraid to come and try it. What stood out with my one-on-one interaction with Dr. Harris was his knowledge on the subconscious as it was. He grew up, as he stated to me, his parents were both PhD recipients. So it's in his background to really dig deep within yourself and to really tailor each client, to what they need and what approach and how to give them the best possible experience.
Yeah, my name's Seth Strader. I came to NeuroRelief sometime in September. At the time, had pretty much threw up her hands. She's been through about 7 years of the torture, I would say, the psychic torture that I would inflict on another unwittingly, but it really was just by chance that I discovered NeuroRelief, and it was honestly one of those things, like, if this doesn't work, I've been through 15, 20 rehabs in the last 10 years, literally, every sober living in Malibu and all the way up the coast from San Francisco down to San Diego, Orange County, detoxes, and it was really, we had read about things, and I actually had a friend who had experienced some relief from it, and we thought, whatever, if there's any possibility that I can somehow get a relief from just this constant psychic overload of waking up with the torture and the self-loathing and the despair and day after day and just needing, there's no separation. There's no, from every minute I woke up till I went to bed, there was never any separation of, I was my pain. Like, if there's physical pain, you can at least identify my knee hurts, But with this, it's like your entire psyche is just completely overloaded with pain that you can't really describe because it's always been there for me. Of course, once I found drugs and alcohol at a pretty young age, that was what I thought I was looking for. Of course, the cure was worse than the disease, come to find out. Early 20s, I was actually able to motivate because I wanted to prove that I could be something, and so I built a career, and was able to kind of manage life, so to speak. I was completely out of my mind, but I could somehow pull it off. And then slowly, as the drug use progressed and the mental illness, the depression, the ADD, that the medication's no longer working, that was probably the scariest part, is when the medications that did work were not an option anymore. Just my history in AA alone, and just the arrests and the 5150s, I've been dead twice from heroin overdoses, dead, like back of the ambulance, not coming back, multiple times hit with the Narcan and not breathing, not keeping a pulse, nothing. And so everyone was pretty much, when I came to NeuroRelief, I was on bail in 2 states. Because the truth is, when I have to have relief, a mind like mine has to be medicated, and the problem with that is I don't know what's going to happen as a result of that. And so when I got here, it was when I finally said, okay, I'll try it. I'm just desperate. I don't know what else there is. At least there's some research that shows this is effective for people with PTSD, it's effective for people with depression, it's effective for people who struggle from long-term drug and alcohol dependence. And so, it was just one of those things that, thank God, really 30 plus year track record of just complete and utter destruction and annihilation and despair. It was, I felt sorry for you. I was like, this poor guy doesn't know what he's getting his hands in, he doesn't know what he's coming up against. But when I first started speaking to Dr. Harris was that it sounds like he's encountered maybe somebody like me, or maybe not as bad, but like in my mind, maybe he can do something. And so the reason why I actually ended up deciding to go with NeuroRelief and Dr. Harris was because of the fact that every other place was very insistent that there's a specific protocol that must be adhered to. And me knowing how much what my tolerance is, and that I'm basically like a horse. Like, I was really concerned that I'm gonna get this protocol and nothing's gonna happen. And I went off on Dr. Harris, and he probably better than anyone professionally anyway, handled the situation, diffused me, and was like, you know what? You're welcome to discontinue the treatment, or you can push through it, because I have a feeling that what you're coming up against is your ego. And of course that hurt my ego, and but there was just like that little bit, like I had to go back to, like, this is your last shot, honestly. If this doesn't work, I don't know what else, like, where else are you gonna go? What else are you gonna try?
When I first met Seth, I saw a man that had so much potential. He, like so many patients that we've seen and clients that follow a similar course, as we see with many individuals that have had trauma during their formative years, his path took him every corner of the spectrum in terms of human experience. This was a gentleman who was amazingly intelligent and had owned a business successfully, incredibly self-sufficient, who remained tortured by a lot of the emotional baggage that comes along with PTSD, depression, the substance abuse that he fell into, and which almost took his life several times, is a pretty common course for a lot of people that have experienced that childhood trauma. Rather than have him go back, relive it, and seek catharsis that way, one of the ways that we try to help people is in the present by increasing their connection to the stimuli that are around them, the mindful appreciation of positive experiences, just simply of the five senses. And with the ketamine as a tool, it allows us to draw them back into the present, to open their hearts again, to unburden themselves, and to begin to absorb that beauty and wonder and awe again from a world that is really just so full of life and opportunity.
And that I had access when something came up, because I was going to take a hard left throughout the first 3 treatments. Like, it just wasn't going to do it. You know what I mean? It's not going to work, because, oh my God, what if I do it and it doesn't work? Then I'm really screwed. So there was that whole component, I didn't know that it would look like this, because what started out as just like a crack of a window ended up being a complete open scape. A complete and open, like, panoramic view, that I just didn't think was possible. I didn't have it within my ability. It wasn't something that was going to come naturally or by any other intervention, because I believe after 30 plus years of seeking relief and help for all of the different issues, I would have found it,
When Simon first came to NeuroRelief, he was really struggling. You could tell he had sort of, in his eyes, fallen from the grace that he had previously enjoyed, and was struggling to rediscover some sort of identity that could give him hope. I think all he could see was the way things weren't working out, and that weighed on him so heavily, was sort of paralyzed in a way.
Hi, my name is Simon. I was suffering from chronic pain for 10 plus years. I was an acrobat, stage performer for like Cirque du Soleil for a long time. And throughout my whole athletic career, I had L4, L5 disc slipping and degenerative. So I think that fear kind of led into depression as well, you know? So I was kind of going down for a little bit, and I went into retirement and moved on from athletic into producing. But that's a pretty significant change of not being so in tune with your body, you know? I've heard about ketamine treatment before, and I asked my doctor about it. He said I'd be a good candidate for it, and he's had patients with results. Started my research, found NeuroRelief, and I'd say my first impression of Dr. Harris was he's a natural healer in a way, or he like cares about people. That comes across pretty obvious right away, because his listening, and he was just asking the right questions and answered my questions well. And then when I could tell so besides his caring, I could feel overall with the information he gave me with the psychoanalysis and his other experience with, I think, mental health and just kind of a wealth of knowledge I could feel from the information he told me about. Each session was different. I knew after the first session that something was shifting for sure. So we set up the full program, and a couple sessions were pretty emotional that Dr. Harris guided me through, which was really good. He was like, I knew him and his team were always there. And then some were just kind of peaceful and out of body. So yeah, a little bit trippy, some of them, yeah. But it felt, it was just all new. So definitely letting go was something that was big for me, that he had to guide me and kind of help me through, because it did get intense at moments. But yeah, it was not like any other treatment. So I'm good where I'm at. Yeah.
Through the ketamine protocols that we designed for Simon, really start to see him sort of open his eyes again, and we enjoyed many great conversations together that I could tell that he really took to heart a lot of what we had discussed, the strategies, a lot of the mindfulness training and the exercises that we worked through. And when he would integrate those at home and we would discuss those between sessions, he started to see that momentum come back and the ability to sort of drop that mantle of the anxiety and just take it one day at a time. It's really been a pleasure to see him emerge, become sort of this independent person again, and we've had such a great relationship in terms of our conversations that we're actually continuing this sort of life coaching that we offer here as a means of sort of helping people get back to the basics. Nothing formal, just good old-fashioned awareness of the beauty of our day and certain strategies to be able to recapture that, to be aware of it, and just to set small achievable goals that allows a person to develop that sense of momentum that really grows into something beautiful.
My name is Sheila, and I've had depression and anxiety for many, many years. I've really tried almost everything I could find to help me get through. Walked in here and I thought, you know, it would be difficult not to be encouraged walking in here, because it was airy, and the color scheme was sort of eye-opening, and I thought that was a great way to start the day. It was with, hey, this looks really nice in here. So over the course of the treatment time, I think what I really came to appreciate was the sincerity of Dr. Harris and of Nancy, and the relaxed atmosphere, and it was a positive atmosphere. Sometimes you can walk into a medical office and just feel the tension of how far behind they are, how booked they are, how you're just barely getting in there, and I didn't feel like that at all. I felt almost like I was just welcomed as an individual. I was welcomed into a place that was going to help me. So I started doing some more research and found the term treatment-resistant depression, which just struck a chord for me, because that is exactly what I have. And that was never mentioned from any doctor that I saw. I talked to a couple of friends that had done the oral ketamine programs, and they had good result with it. For me, I felt that the infusion program was going to be good because I feel like I had tenacious depression. It just wanted to hang in there no matter what I did, exercise and mindfulness and therapy and all of those things that I tried. It would just, slowly slide or immediately slide right back. I actually did a whole lot of research because that's just the kind of person I am, and I thought that it was really exciting that not only could it help depression, but that it can actually stimulate the nerve to regrow some of those cells that are dormant in people with depression and PTSD. So that was how I got here. Why did I choose Dr. Harris? Well, and then I read some of his reviews and decided to call him. Well, the treatment itself is difficult to describe. Initially, you go into the treatment room and lay down in a comfortable chair. After the first treatment, I realized what I needed for myself to make myself comfortable during that time. So I brought a couple of things, pillows and blankets, just because I wanted to feel warm and fuzzy, set myself up for success. And then I would talk to Dr. Harris for a little while and sort of tell him what was going on and how I felt since the treatment before. And there have been a lot of eye-opening things for me along this journey, which left me always with something to talk with Dr. Harris about before my treatment. One of the things that surprised me, and one of the reasons that I started with NeuroRelief, is that I called and Dr. Harris picked up the phone. And I got to talk to Dr. Harris. We talked for about 20 minutes, which was great. I felt like I had an immediate rapport with him. And in addition to that, Dr. Harris was always available for me to talk to. It was great because I am a believer that the more feedback that I give to a professional, the better treatment that I'm going to receive. So when I came up with questions, and there were a lot of them, I would send them to him, and the response was, never long. He never kept me waiting on a response.
When I first met Sheila, I saw a woman who loves her husband, loves her family, and has a very nice life. However, she didn't seem to be getting the most out of it. She didn't seem to be enjoying the stimuli that are around her daily, and she felt the absence of that positivity, especially with an abundance of options. After she completed her 6 sessions of the stabilization protocol, it literally is like a completely new person. She is a bubbly, joyful person who it's been a great pleasure to be a part of her treatment, her recovery, and her ongoing journey to get excited about every single day and the possibilities and the beauty that the world holds all around her. It's just a real pleasure to have known her and to continue to be there for her for any assistance that she may need.
Since I completed the 3 weeks treatment, there have been a lot of things that have changed for me. I think it's kind of funny in a way because I know I've told probably 10 people that I've gotten this treatment because I'm so excited that it worked. After the second treatment, I really started feeling brighter, and my husband would come and wait for me and then take me home, and it was really fun to see us laughing, to have us laughing driving home in the car afterwards. After each treatment, there was something new that I found after each treatment. And that to me was amazing because it wasn't just, okay, I got to a certain level and now I'm going to stay at that level. It increased most of the time. A couple times it went down as far as my feeling afterwards. I think the reason I feel so comfortable recommending NeuroRelief is that my experience with them doesn't seem exceptional. It seems like other people are getting that kind of treatment here as well. And I see with other clients, patients coming into the office that everyone is treated with that compassion and respect. And that makes coming here just so much easier. I think what struck me when I did the research, when I found out about ketamine treatments, and when I did the research on it, it made me feel like this wasn't just a Band-Aid, that this was gonna really help me in the long term. Benefit is that I just don't feel that constant exhaustion. And that's what's helping me be happier and helping me get things done, helping me to reach out to my friends, be lighthearted with my family, enjoy things that are happening rather than focusing on, oh no, here's the next thing that will happen, and going downhill from there.